Yeah, I think we can get started. So hi everyone, my name is Kat D'Souza. I am an intern on the evidence and implementation team at AMCHP, and I'm here with our my coworker Jake and our lovely presenter Mava. So if you two want to introduce yourselves.
I'll go first,
Hi.
Jake.
Sure. Hi, everyone. I'm Jake. I work on the Women's Mental Health team, but I've been assisting with the Adolescent Health team, and we've been creating a module resource about adolescent health. So this was a very timely presentation.
Good. So I'm Mava. My pronouns are she, her, and I am from the Adolescent Health Initiative. And so we're out of the University of Michigan, like you heard from the presentation. This is unfortunately not my background right now because it's raining and terrible in Michigan today, but I wish it was. And my co-presenter, Dr. Jameson, is unable to be here today. So he is a clinician and I am not. So if you have any very clinical based questions, I'll be sure to connect with him on it and hopefully we can get you the answers that you need. But he's doing his thing today, seeing patients.
Thank you so much for sharing. I had one question as I was watching throughout the video, but I noticed the term psychotherapy was mentioned. I was wondering what the difference was between psychotherapy and regular therapy, I guess, and when a patient would seek out one versus the other.
That's a good question. I think psychotherapy is a general term that's used for a lot of different kinds of therapy, but I'm not really sure about that, to be honest. I don't know if there is a difference. I think that we talk about the different kinds of therapy in the module that I was talking about in the training, the suicidality for primary care providers. And we just call it psychotherapy. So I think that's an umbrella term, but I'm not really sure, Cap. So that's a great question.
If anyone has any questions, you can please feel free to message them in the chat or feel free to unmute yourself right now and ask Mava.
Yeah. And I think, Sarah, I don't mean to like call you out, but I think you're presenting at our conference in August and that some of our youth are presenting with you. So hi, it's nice to see you on this call.
Yes, thanks. I'm very excited to present and attend. I just got word that I'm allowed to attend in person too. So we're also trying to work through these topics and especially providing support for clinical partners in this topic, trying to kind of fit in where MCH and public health can fit into this mental health work, because we have a lot of work happening in the state at the community level and at the school level. And so I'm really kind of trying to fill gaps and figure out this, where our work should be focused, where to focus our resources through MCH. And so this is definitely one of the areas we're leaning. And so I was very excited to participate and it was really helpful.
Definitely. Thank you.
I had one question, or sorry, Kat, to cut you off, but I was wondering about incorporating mental health into schools, because in our research, I have learned that students are much more willing to discuss their mental health through a school-based provider rather than a community-based provider. So I was just wondering if you had any thoughts on that.
Yeah, so we work with school-based health centers as well. And they follow a lot of the same guidelines as I talked about in this presentation. They're often set up a similar way. And I think you're right that there is a lot more space for them within the school to have these conversations. One of the things that we encourage school-based health center, especially behavioral health providers within that setting to do, is group therapy sessions within the school. Because youth are there, they're present. That's they don't have to go anywhere to get those services. They can just be released from class and join in on some of those things. We also encourage integrated behavioral health services within school-based health centers. So oftentimes they'll like contract out with behavioral health providers, but we encourage them to have somebody on staff, which some of them do, but it's not always consistent across all schools. So yes, I would agree with you, Jake. It's very important. And I think that schools do have that like pretty strong line to students that they don't have to go anywhere else to get services. They can just be there in that space. I don't know if that answered your question. So if it didn't.
No, it did.
Let me know.
Thank you.
Sure.
I have another question about your opinion on what the most impactful thing you think a primary care provider can do for their adolescent patients. Because I know that you presenting with Cornelius, there was a lot mentioned, but I was just wondering, in your opinion specifically, what you think is most impactful that they can do.
Yeah. I'm trying to like channel our the like young people that we work with too, and thinking about like what they would say about this same question. And I think one of the most impactful things from my side of it is the confidentiality and minor consent information, and that crosses all areas. I don't think that young people often know that they can talk to their doctor about certain topics, and that when they talk to their doctor, it won't be told to someone else. So I think a young person going to a doctor's appointment, especially if they're going with a caregiver or a parent, they don't know that they can talk to their doctor about mental health or sexually transmitted diseases or really any other kind of topic that they wouldn't want their parents or caregivers to know about and not have it be told to them. And so I think that's one of the most important things that a provider can do before you do anything else, is just say, hey, these are the things we can talk about today, and I won't tell anyone unless, something comes up that we need to tell somebody. Because then the young person trusts you and they feel comfortable telling you about those things and getting issues resolved, whereas they might not talk to you about that before. I'm trying to think. Yeah, I think that would be what our young people would say also, and thinking of conversations we've had with them in the past and just being asked the questions. I think that's a big one too. If a provider doesn't ask a young person, how are you feeling? Like what's going on with your mental health today? Or, are there any issues? It's hard for them to just bring it up on their own. So I think being asked the questions is really important as well.
Thank you so much for sharing. Does anyone else have any questions or comments that they wanted to say? You can type them in the chat or unmute yourself and say them to Nathan.
Hi, this is Sarah again from Ohio. One of the things that we have, again, tried to look at when it comes to some of those relationships in the community with clinical providers, what we've heard is that pediatricians or primary care providers can do the screenings and then maybe struggle with follow-up, that referral loop and following up on that. And so just wondering if there were any resources or best practices or tips that you guys have come across in helping close that loop and help kind of forge those connections, whether it be between families or community providers, schools and clinical providers.
That's a really good question, Sarah. So we just worked on this resource and it's called the Integrated Behavioral Health Power Meeting. And I think it's just this week going live. And that is the sole topic of this resource. It talks about how do you build those pathways within your system and those workflows within your system so that you are not losing any youth, and that you are being able to follow up with them and connecting to their behavioral health provider if they're not. And I am going to get on our website right now and see if it is live yet. But if not, I would keep an eye out on the website, and that resource has everything you could ever think of or want to need for that topic. So that's probably where I would encourage you to go for that. I'm looking to see if it's live because I want to put it in the link while we're all here. That might take me a minute, but yeah, I think that's where I would direct you, Sarah, and that's kind of where we've been like accumulating all of the resources that we have on that topic. Did that answer your question?
Yes, it did. Thank you.
Okay.
Very good timing. So I'm glad,
Yeah.
I'm glad I asked, and I'll keep my eye out for it.
Yeah, let me see if I can find it for you. Yeah, it might not have gone live yet. I know it's supposed to this week, so I'll check in on it, and I don't know how I'll be able to like get it to everyone, but we'll figure out a way.
Hey, that sounds great. Thank you. I'm sure I can find a way to get everyone's emails, but does anyone else have any last questions, comments that they wanted to say before we end the discussion? Okay, well, thank you so much for being here, Maeva, and for speaking to us today about this very important topic. Everyone give a big thank you to her, please, because she was amazing. And yeah, just thank you so much for being here today during our conference.
Thanks, everyone.
So I'll log off of the Zoom, but it was a pleasure meeting you, Maeva. Also, you as well, Jake.
Yeah, it was great. Thank you, Maeva.
Thank you both. Have a great rest of your day.
You
You
too.
too.
Bye.